If you've been on a Medicare supplement plan for a while, you've probably noticed the rising costs, and you might be wondering if it's time to make a change. Or you're wondering, how can I save some money while having this plan? If you are healthy and you don't have any upcoming procedures, you may be able to keep similar coverage for less by switching carriers or choosing a slightly lower coverage level. But there's another option that's very popular, and you might be wondering if it's right for you, and that is a Medicare Advantage plan. So let's just start with a quick refresher. Medicare Supplement plans, also known as Medigaps, help to pay for some or all of the out-of-pocket costs not covered by original Medicare, like deductibles for hospital stays. You go into the hospital and you come out without a bill. And that 20% coinsurance for outpatient services, which has no cap under original Medicare. These plans are great for predictable costs. It's great because Medicare is the primary payer. You can go to any doctor or facility that accepts original Medicare, and you know what your costs are going to be. But we also know that those costs and premium prices keep rising every year. So we have that monthly premium, and then we also know that prescription drugs is not included in that. So that is another plan that we have to add on to the supplement. And then it doesn't cover the other things that original Medicare doesn't cover, like dental and vision and hearing aids. So the other option to coverage when you have original Medicare is the Advantage plan, also known as Medicare Part C. And they are all-in-one alternatives to original Medicare. These are offered by private insurance companies, and they often include prescription drugs, dental, vision, and hearing benefits, fitness programs, and sometimes even transportation or over-the-counter allowances. So what are the advantages of a Medicare Advantage plan? Well, you have lower or even zero monthly premiums. Some plans even give you money back into your Social Security check to help pay for that Medicare Part B premium. They are bundled benefits so that you have those extra benefits like dental, vision, and prescription drugs. It's simplified coverage. You're carrying one card to cover everything. And there is an annual cap on the out-of-pocket medical costs that you could incur. So there's a limit to how much you could be spending in a year. What are the considerations then when thinking about if switching to a Medicare Advantage plan is right for you? Well, when you choose a Medicare Advantage plan, you're choosing a carrier to manage your medical costs. So we would want to choose a carrier that works well with the network of doctors and facilities that would be right for you. Most plans are either an HMO or a PPO. With an HMO, you'll need to see in-network providers for coverage, except in emergencies, where you have nationwide and some even worldwide coverage. And then in a PPO, you have more flexibility to go out of the network, although the cost is generally higher when going out of the network. With Advantage plans, you'll pay copays or coinsurances when you use services. While the plan does protect you with the annual maximum out of pockets, your costs can vary year to year depending on your health needs. But if you have a healthy year, you could end up paying very little or sometimes even zero out-of-pocket costs. If you're thinking about switching, timing matters. You can usually make the move during the Medicare annual enrollment period, which is October 15th through December 7th. And here's something important to know as well. If you're switching from a Medicare Supplement to a Medicare Advantage plan, you don't need to go through medical underwriting. Plus, if you've never been on a Medicare Advantage plan before, you get a 1-year trial period. That means if you try it and you decide it's not for you, you can return to your previous Medigap plan within that first year with no medical underwriting and at preferred rates. So it's somewhat risk-free. After that first year, or if you've had an Advantage plan before, you'd need to apply with the medical underwriting to switch back to a supplement. And there's no guarantee you'll be accepted. Before making the move, we'll go over a few important things together. Are your doctors and hospitals in the Advantage plan network? Which plan covers your medications most affordably? And which extra benefits like dental, vision, or hearing would you actually use? As your advisor, I can help you put together a package that keeps your costs low while making sure you're well covered. If you're ready to explore switching from a Medicare Supplement to a Medicare Advantage plan, let's work together and make sure you're saving money while staying protected. The right plan should support your health and your wallet. If you've been on a Medicare supplement plan for a while, you've probably noticed the rising costs, and you might be wondering if it's time to make a change. Or you're wondering, how can I save some money while having this plan? If you are healthy and you don't have any upcoming procedures, you may be able to keep similar coverage for less by switching carriers or choosing a slightly lower coverage